Well, thank you all for coming this afternoon to the library to hear our press conference about the initiated measure patient choice. Many of you are aware that we put an initiated measure before the people of South Dakota to have them have the ability to pick the doctor that they want, pick the provider they want, and make the kind of health care decisions that are important for them when they choose to interact with the healthcare system or when they're forced to. We collected a little over 30,000 signatures. Last week we received notification from the Secretary of State's office that after a 5% sample rate our signatures were valid. We collected way more than necessary according to the initiated measure provision in the South Dakota Constitution. Citizens of the great state of South Dakota will be able to vote on initiated measure 17, what we call the patient choice initiated measure. My name is Blake Curd. I'm an orthopedic surgeon here in Sioux Falls. I practice at Orthopedic Institute. I've been here for about 12 years, and I personally have seen how patients have lost their doctor, lost the hospital of their choice, or lost another provider that they had a long-term relationship with through no fault of their own. We're all aware that the President promised us several years ago that if we had a doctor we liked, we could keep them, and unfortunately we hear every day about another individual who's lost a doctor that they can't keep any longer. And we believe that here in South Dakota it's important for patients to have the right to pick the physician or the institution or any other provider that they would like, the person they think is most capable and best equipped to help them make the choices that they need to make in their healthcare decisions. And that's why we brought initiated measure 17 forward. It's a very important thing for healthcare. We think it's a step forward for the healthcare consumer in South Dakota, and we're pleased to see that they'll get a chance to vote on it next November in 2014. Let's say that you happen to work for an employer in South Dakota that provides you with healthcare insurance or healthcare coverage, and then through no fault of your own, that employer decides to switch to a different plan. And that plan may no longer include the healthcare provider that you have a long-term relationship with. And you have to make a decision. You either keep the health insurance that the employer is offering you, the new health insurance, or you can search for something else on your own, which at this point is probably cost prohibitive, and you lose the ability to pick the physician or the hospital that you would like for your care. The law allows patients to choose the provider that they would like with no additional copay, no additional out-of-pocket, no additional deductible other than what the current insurance that they have offers, as long as the provider is willing to abide by the terms and conditions of that particular healthcare plan. It depends on a case-by-case basis, but a physician might reject an insurance because of the reimbursement rate. They might reject it because of the regulatory restrictions that are placed upon the plan or some other nature. Anybody that has perhaps an integrated delivery system where they have a health insurance product, a hospital, and then employ physicians, that could be one example, and it could be anybody in the state that has such an arrangement. Take somebody that has a very complex set of healthcare issues, someone that maybe has high blood pressure and diabetes and kidney trouble and maybe cardiac difficulty and is very sensitive to medications and has spent a number of years getting their medications balanced just right, where they feel good every day, they know what the regimen is, they know they take one blue pill, one red pill, one green pill, and half of a brown pill every day. And then they go in and they have to find a new doctor, and they have to start all over again. And the new doctor may not understand their history, may not understand their healthcare conditions in the aggregate, may not understand their own physiology and how it's been difficult to get them balanced on that set of medications. They have to start all over again from scratch, and that can be very disruptive for somebody. It's not recent, it's more cumulative, I would say. It's story after story of patients losing their primary care doctor, people not having the ability to choose a surgeon that they might want to choose. We've heard this from physicians where they've practiced in a small community in South Dakota for years, and then a major health system may move into town and buy a clinic, and suddenly they find that their patient base has evaporated because they moved into town and offered an insurance product that doesn't include them in the network, and so they lose their ability to take care of people that they've seen for years and years. I have not lost patients personally, but I have had patients who have lost specialists in Sioux Falls because of decisions that have been made either by their employers or by an insurance company here in town that has caused them to lose their doctor. Their doctors become out of network. Yeah, let's say you have an orange health plan for 10 years with a doctor that's orange, and your employer, let's use the Argus Leader, decides that they're going to become maroon. They've now picked maroon health insurance, and they give you a list of maroon doctors, but you really like the orange doctor. With this initiated measure, you could go see the same orange doctor you've seen for the last however many years, with no additional copay, no additional out-of-pocket expense to you. They may still be able to get a cheaper rate depending on how the different insurance company will contract with them, or the number of lives that they can offer, the number of covered individuals for that particular plan. So they may still be able to contract for rate with that particular insurance provider. But it wouldn't cost the insurance company any more out of pocket, because they would pay the same to Dr. Orange, assuming that that doctor would take the reimbursement. It's whatever the rates and terms are. So if the Maroon doctor is in network and they pay $10 for a chest x-ray and an evaluation, and the Orange doctor will take $10 for a chest x-ray and evaluation, it's the same. There was a very similar legislative vehicle last session. It passed the House committee, I think unanimously, passed through the House floor by a large majority, passed the Senate committee by a majority, and then was defeated in final passage on the Senate floor. And we thought it was best to put this measure in front of the people to exercise the constitutional right that the state provides through its constitution to allow us to put it in front of the people for a vote. We thought it was that important, especially in the environment that we're all facing with the Accountable Care Act.